Welcome everyone to Patient Voices Across Europe podcast. In this series, we speak with members of ELPA SLD working group. This is a dynamic team of advocates from across Europe, committed to raising awareness and driving change around steatotic fatty liver disease, also known as MASLD. And in each episode, we bring you local insights, patient perspectives, and solutions from the ground up. Our guests are not just members, they are change makers working with their communities to shift policies, fight stigma, and empower patients. And so thank you very much for tuning in. And today I am extremely happy to welcome in our podcast studio Tarja Teitto-Tuckett from Finland. Hi Tarja, how are you? Welcome.
Thank you so much for this opportunity.
I see you smiling, so I think this will be a very nice chat.
Yes, I'm very proud of all the activities we are doing back home, and very proud that I can be sort of saying and telling other people about our activities, which are actually making, I think, quite a significant change on our field.
Great. So let's just dive in. Tell us a little bit more about your activities in Finland and your association.
Yes, so the name of our association is the Finnish Kidney and Liver Association. Mm-hmm. So which practically means that we will have people with kidney diseases, different liver diseases, and also transplanted patients. So it's quite a big scope, yes.
People.
And they're going to be sort of like all age groups that we are wanting to take care of. Mm-hmm. In order to do so, in order to spread our activities across Finland, so we have 18 local associations. So they are all volunteers, and we are working very well with them. And we are running a national campaign so that they can also take it to the local level. So that is probably the arching, what our activities are all about.
Tarja, you are a very passionate advocate. You are also part of ELPA SLD working group, and I know this is something close to your heart. Mm-hmm. So tell me a little bit how you are perceiving your involvement in this group, and how you see that when people are together and when same-minded people are together working towards the same goal, is really this what we need in order to make change and to see the changes?
Yes, I think it is, because on a national level there's only so much you can do. Mm-hmm. And there are so many people who are the same-minded people. But maybe we don't get a wider perspective of things. So therefore it is very, very important that people from different countries are sharing what they are doing. They are having the time to talk about these things, and maybe then to invent new ideas how to get our message across, which is probably sometimes felt like it's always a repetition of the same things, that healthy diet and then yet again reduce the weight and these kind of things. Mm-hmm, mm-hmm. And it doesn't really tell anyone anything, to be honest. So therefore we need
you are a person that really likes to go deeper, yes, not staying on the surface, and I really like that about you, because you are really going on a practical level. What does that mean for patients in an everyday life, right?
Yes, indeed.
Tell us a little bit about your professional background.
This is very interesting. Okay. Yes, one of my profession is nurse. I'm a nurse. So from there, I've always been sort of worried about people that they hear something, but they don't really know how to action it in their real life. So that's one thing. And also I have studied the adult education. So this gives me the background also for change, how the personal change can be made or why it's not happening. So I think this is helping me very much indeed for the work I'm doing at the moment.
I think this is very important aspect, like your background, as you said, all of these learn things and how to speak with people, but also with people living with certain diseases, right?
Yes.
There should be the right terminology. There should be the also safe environment. We spoke a lot about on ELPA podcast about multidisciplinary teams and how that structure is extremely important. Supportive network from different angles. What I wanted to say is in the scope of also MESL, the lifestyle intervention is extremely important. So I really like your comment when you say, okay, these are the instructions what someone should do, but the practice is often very different, right?
Yes,
so
the
how is the thing that people usually struggle with. Is that correct?
Yes, I think so. Yeah. So in practice, how we are trying to tackle it. So we're doing residential courses for people who have, for example, liver disease or kidney disease. And in all of those residential courses, we are showing them, the practical ways how to do things. However, we have now almost 1.5 years, we have been running online cooking courses. And
how does that look like? Walk us through.
It is actually a very simple thing. So they sign up to a topic, that they think that it is nice. So we are running those courses once a month. And then a week before, we are doing the cooking together. So they will receive recipes, and then they can have the shopping list at the same time, so that they are prepared to do the recipe in their own kitchen. And then there is the online guiding to it. And it's a kind of it's also very nice because we are talking each other. So if there is a difficulty or if they have a problem, so there's a professional who is guiding people to do these recipes. And we are focusing on vegetarian meals and also how people are using the alternative protein-rich, sort of plant-based products.
I think it's a very nice initiative also from the point of view of this like sense of belonging to certain community, right? To have that support system and motivation when maybe sometimes it's not a good day or you're lacking the motivation to follow through your daily activities.
Absolutely, and there we are sort of giving guidance, how they can manage their sort of weekly sort of meals and all and everything. So we are doing a fairly holistic understanding, how to run your diet better, but also then to giving them the experience as well. And then when they are tasting things, so the feedback is also very nice what they're giving. And we have probably 40 people online, and there are more people who are ordering.
That's not a small group, 40 people.
No, it isn't, but could be more. But on the other hand, so when everything starts, so it starts small and then it gets bigger. But that's a very practical thing. On the whole, so I think that we have a problem that we are still stigmatizing individuals, that they are not doing enough, or that something what they are not doing, it's not working, so they are not trying hard enough. And I think that view is very old-fashioned, because we are living in an environment where quite often you will choose and select things which is around you easily. And I think that here we need also a slightly sort of higher level advocacy, that we would try to educate, the wider public, about the lifestyle or what they are selecting or what they are choosing. So I think that there are really two levels that we are working all of the time. And our Liver Weeks is a good example of how we are trying to influence the wider public, or even the decision makers, or maybe even people who are working in the medical field.
You mentioned your Liver Week. So this is an activity that you do every May, every year, right?
Yes, we do, yeah.
Tell us a little bit more. So, how many people are part of this week? What kind of things are you doing? Is it like a presentation, workshops, just educational trainings, capacity buildings? What exactly?
It depends on the year. It depends on the year. So we are trying to do different activities, different years. This spring, what we chose to do, was that we wanted to raise awareness yet again about this SLD and in all aspects, and increase the understanding that this steatotic liver disease can be also found in children or adults. So the life sort of like a spectrum of this disease is something that we are trying to encourage the understanding as well, that this is probably the only liver disease that is reversible. So we need to do something about it, and as early we can do and tackle it, the better. And therefore this year we were doing a broadcast from children's liver disease, how it's diagnosed, and also then what mechanisms may be there which is influencing that children are having this, starting to have this disease. As well as we were having another speaker who were talking about what does it mean that children are not active anymore. So from this perspective, so that even the little steps we are doing so are helpful within children. Then we also did a very practical event talking about the liver health as such, together with the physiotherapist who was giving sort of like really sort of simple ideas how to increase your muscle power and preventative the sarcopenia, which is quite often the result of not moving enough and not eating well enough, you know, all the proteins and everything which is needed to build the muscle. And then the third main focus this year was probably we were able to go to the Finnish Parliament, and we gave a kind of an event there which was, we were challenging some of the members of the Finnish Parliament to come and answer to our challenge. So
What kind of challenge?
The challenge is that how can we tackle the big problems, not only the kind of SLD or obesity, or then yet again the alcohol consumption, which is also then a very sort of neatly connected with the problem we have at the moment. So as on a national level, so I think that the diseases, the biggest diseases which is untackled yet, is yet again the obesity and then yet again the alcohol consumption. So all the other common diseases we have started to get under control, and we have really good pathways, and we have really good ways of treating them, diagnosing them and maintaining. But these two are big, and in the Parliament, so we were talking about mainly this liver deaths via the alcohol consumption, but also then the SLD, so steatotic liver disease. And we were just saying that we need to diagnose it earlier, and early prevention is something that we need to focus on. And we were then getting 4 members of Parliament to answer the challenge that do we do it enough early, and do we have enough resources for it. So, and to support it, so we were also gathering understanding from the healthcare professionals and the well-being area decision makers, you know, how they understand the problem. So do we have pathways that are doing the early treatment or even early diagnosing of the disease, and how well is implemented all over Finland?
It sounds like a very, very busy week you have every year.
Yes, it is, but I suspect that only when you are passionate about it, so you can do it. So we think that it is so important. We need not only the understanding of the healthcare professionals, both in the primary sector and also in the secondary sector, that if we diagnose something, we are not following it up, or we are not doing a good sort of like understanding between the patient and the healthcare professional. So what is happening next? We are actually losing the moment that the person wants to change something that she or he can change. And therefore I think that the early detection is something that when they have the moment that they are realizing that, oh, I'm really going not in a good direction, so how can I change it? So then yet again, what services are there for them that they can use, that they can change it together with another healthcare professional?
Exactly. And you mentioned also the support from physiotherapists and dietitian nutritionists, which are part of so-called multidisciplinary team.
Absolutely.
So my question to you is about that. How does that work in Finland? What are your experiences with multidisciplinary teams?
It works really well when you go to the secondary care, but then the diagnosis is already quite far. So it may be almost late to think that then the SLD would be a reversible sort of a disease. So therefore, what we are really needing, that we need the prevention, we need the primary care understanding, that there needs to be services that people can use easily. And I would add to the group of dietitians and physiotherapists, I would like to add another very major sort of part, which is the psychology or psychiatric nurse services. Because sometimes there is accumulated burden somehow that one needs to release that first before you can start doing your life changes. Because, I mean, one wouldn't arrive to difficulties if there wouldn't be obstacles that they haven't been able to accomplish before.
I think from your speech, we can clearly see that you have these experiences working with people living with diseases, that you have this, sort of touch and understanding how to approach them, and to understand that sometimes maybe there is this pre-step, such as you mentioned, mental health, to work on that before person really dive into instructions, what he or she should do, right?
Yeah. So when a person is ready to do the change, they will do it if they have resources for it. So, I mean, the worst case scenario is that the person is guided to somewhere when they can then see that, oh dear me, I'm failing again because I can't do it. I don't have resources for it. So even to start with one change is better than trying to load them with a big plan what they need to do in order to be perfect people and thrive perfectly. Because that is not the question really. We are ordinary people and we are having ordinary life. And we just need to understand the one or two things that we can do to ourselves to feel better.
And a lot of speakers today, they are stressing out this fact, like that the fact that we are perfectly imperfect, right? That there is no perfect scenario, that we all have ups and downs, and it should be open conversation, that it's just part of the journey. Tarja, you mentioned that you did quite a big research also about the awareness in your country among healthcare professionals, but also decision makers, policy makers. Can you tell us a little bit more about that, and what are the results? Where are you standing, and your next steps? Because I think you have already prepared steps.
Well, we try to learn what we are studying. So we try to learn, where to go next. So I mean, the survey what we were wanting to, or we did deliver to healthcare professionals, which means mainly the doctors in the primary care, secondary care, occupational health, and also the well-being decision makers who are then making the decision how to deliver the area-wise the monies for the healthcare. So it was very interesting to do that, and also to understand that even though we were sending out about roughly 2,000 emails, attached to the questionnaire, which was then made yet again with the kind of like a high professionals to check that the doctors would be answering these questions. So we started to have very little response, and we were just very puzzled that what is this all about? Why are people not answering to this? And we were wondering that, doctors are getting so many reviews to fill in, and they are very busy, and there's shortage of doctors, and there are all kinds of reasons. However, then we started to think it the other way around, that okay, what if this is not only a sign of lack of time? What if there is something behind it? And what can it be? And is it then only that that doctors don't really know how to answer our questions, and our questions regarding the pathways, how they diagnose, and when they diagnose, where they are referring people? or what kind of services there is to refer to. So these were just very interesting, and we came just very quickly to the conclusion that we absolutely need more expertise in this field. So we need to provide more education for doctors, nurses, and wider public. If wider public would know what to ask for, then it could be easier for them to get the diagnosis earlier.
Yeah, so
that is one way of
from
doing
both
it.
ways.
Mm-hmm. But it needs to come together.
Mm-hmm. Mm-hmm.
So the doctors needs to be more willing also to diagnose earlier. And the result actually was that all the doctors who responded to the questionnaire, so actually only 4% of them were saying that area-wise they have a certain direction where to go, a kind of a care pathway, what they follow, and united way of dealing with this issue. And I think it was actually quite shocking. So
for everyone.
Yes. So also then we think that we were kind of like, after discussions with also the healthcare professionals and university doctors, we came to the conclusion that it is really needed a kind of a strategy or the mutual sort of like understanding that how we start tackling this problem. So maybe this is one upmost on our minds that we would like to take forward.
What kind of tools to use to increase this awareness
exactly
in different audience group?
Yes, absolutely. So this work is only starting now, but I think that this was a good cooperation together with everybody who was responding, and then all of the other stakeholders that we are talking with, that what might be the reason that doctors are not very keen answering all of these questions, which were very reasonable indeed.
And what about the questions to decision makers?
Yes, and it is very interesting because in Finland we have an institute which is called the Finnish Institute of Health and Welfare. And they are listing common diseases. And when a disease is on the list, so it gets more attention and more resources. And funnily enough, the liver diseases are not on that list at all. So the decision makers, we were asking that should, for example, the SLD, steatotic liver disease, should it be on the list? And it was that almost 80% who were responding to our sort of questions were saying that yes, it should be on the list. And also we were pointing out the liver cirrhosis as well. So should that be on the list, on that same list? And it was 65% who were saying that yes, it should be. So we were naturally trying to ask decision makers something that they didn't have to have the doctors sort of training, the background in order to answer these questions. But I think that I would like to highlight that these were the two big ones that they thought that okay, these diseases or liver diseases are causing so much troubles and they are costing a lot to the society. And also there is then the human aspect of it as well. So if you are a working age person and if you can't work, so because of these diseases, whatever they are causing, or the side diseases or whatever you would say, so yeah, naturally we would need to start to put this right.
It's really great news to see that decision makers are or do understand this domino effect of liver diseases affecting also social economic part of the whole country, right? It's not just a problem of people living with liver diseases, but it's like a national problem that it's increasing and should be taken care of.
Yeah, and there was a recent study which was saying that only the steatotic liver disease in these different forms is adding cost about 5 billion euros a year to society. So it's not a small money really. So if we were to focus on preventing or early detection and really sort of following that people are able to change things with the support of healthcare professionals and other professionals. And I think that we also to that need some other stakeholders to support the life changes as well. I think that the food environment we are living at the moment is one, and then particularly I think that in Finland the alcohol consumption is the other one. And it has been very interesting as well. We have had the World Health Organization. It was already a year ago they visited Finland, and they wanted to run a nice event promoting that we are doing well having a monopoly in Finland, that don't destroy it. So that you wouldn't be able to buy alcohol 24/7.
Yes.
Or even to have it delivered to your doorstep or anything like that, because the one factor that we can count on is the access to alcohol. If there's a reduced availability, so then maybe the 5 bottles a week will be left, not on board. So what we are saying that because we have access to all commodities in Finland, so everybody can go and buy whatever they like. But then our question only is that, does it need to be 24/7?
I think this is a tricky question that you will have to solve in Finland, but also other countries in Europe. Tarja, thank you very much. We are slowly coming to the end of our session. I must say that you are doing some amazing things in your country, not only for the people living with liver diseases and capacity building and building the community and supportive network for them. But as you mentioned, you are also investigating the level of awareness among different, as you said, primary care doctors, secondary care, then also policymakers. So you're really trying to understand where are you standing right now in order to make the right move with the right tools.
Yes, and I think that probably our statement is that really the biggest difference we can make to have the proper pathways for early detection and timely treatment. That we believe very strongly.
Amazing statement. Nice closure of our session. So Tarja, thank you very much for being with us and for sharing all the great things that you and your team are doing. I wish you all the success for the next years. So thank you very much for tuning in. Enjoy the rest of the day and goodbye.